Now we're moving into running analysis. Before we start, let's frame what this lecture is doing in the context of other GATE lectures. Everything in this running lecture is an amplification of what you learned in the walking gait, trunk and pelvis, and hip mechanic lectures. If something feels difficult here, that usually means the underlying walking or trunk/pelvic concept wasn't solid yet. Running analysis builds directly on walking gait, trunk and pelvis control, hip mechanics, knee mechanics, and foot and ankle. If walking is controlled falling, running is controlled rebounding. Every concept you learned previously still applies, just under higher forces, shorter contact times, and greater reliance on elastic energy storage. By the end of this lecture, you should be able to describe running phases, explain joint and force mechanics, identify common deviations and injury links, interpret EMG data, and, most importantly, translate all of that into clinical decisions for injury rehab and performance. Running analysis is not a separate skill from gait analysis. It is gait analysis under stress. Running is simpler in structure than walking, but more demanding physiologically. Unlike walking, running has no double support. At no point are both feet on the ground. Instead, we introduce a flight phase, which fundamentally changes how forces are managed. This means the body must absorb and generate force rapidly with single limb loading only. This is why deficits are hidden during walking but become obvious during running. If a patient cannot tolerate single limb stance well, they cannot run effectively. Let's explicitly compare walking and running, because this helps you predict injuries. Recall from the walking lecture that double support allows the body to hide deficits. Running removes that safety net. Walking includes double support, lower cadence, and minimal vertical center of mass displacement. Running eliminates double support, increases cadence to roughly 160 to 190 steps per minute, and introduces significant vertical center of mass oscillation. This means running is more plyometric. Tendons, especially the Achilles and plantar fascia, become major contributors through elastic recoil. From the trunk and pelvis lecture, remember that poor proximal control increases distal loading. That relationship becomes magnified here. Something to think about is that many foot problems in runners are actually trunk or hip problems expressed distally. All right, so overview. The running cycle is divided into stance, which is about 40%, and swing, which is 60%. Compare that to walking, where stance dominates the cycle. In running, stance is brief and violent, force spikes quickly, while swing is long and critical for limb repositioning. Because stance is short, there is very little time to correct errors. This is why technique matters more in running than walking. Normal running mechanics. Running mechanics differ from walking in three major ways. First, there's no double limb support. Second, stance time is dramatically shorter. Third, joint excursions are larger, particularly at the hip and knee. Initial contact can be rear foot, midfoot, or forefoot, depending on speed, footwear, and training history. Mid-stance is where maximal knee flexion occurs and energy absorption peaks. Propulsion relies heavily on ankle plantar flexion and hip extension, with the gastroc soleus complex acting as a powerful spring. And then we have the swing phase, which is also known for limb recovery, where we have increase in hip flexion and eccentric hamstring activation. The faster you run, the more the ankle behaves like a spring and less like a simple hinge. All right, normal joint kinematics. Let's walk through joint motion because this directly ties into deviations. At initial contact, the hip is flexed about 20 to 30 degrees. The knee is at 20 to 40 degrees. And the ankle is near neutral to slight dorsiflexion. During mid-stance, knee flexion increases to around 45 degrees to absorb load, while the ankle dorsiflexes further. At toe off, hip extension reaches 10 to 15 degrees and ankle plantar flexion peaks around 20 degrees. During mid-swing, the knee flexes dramatically up to 90 to 100 degrees to allow limb clearance. This reinforces a key theme from earlier lectures. Running magnifies sagittal plane demands. The ground reaction force and the center of mass. Ground reaction forces during running are approximately 2 to 3 times body weight, compared to about 1 to 1.2 times in walking. In the walking lecture, we emphasize ground reaction force position relative to joint centers. That same rule applies here, just faster and stronger. Vertical loading rate, not just peak force, is strongly associated with tibial stress injuries. Heel strike runners often demonstrate a distinct impact peak, while forefoot strikers tend to attenuate that peak. A higher cadence reduces vertical oscillation and impact loading by shortening stride length and decreasing braking forces. This is running version of reducing external moments by changing lever arms. Same principle you've learned with trunk lean and pelvic control. A 5 to 10% cadence increase can meaningfully reduce injury-related loads without changing strength. So for muscle activation, muscle timing in running is highly anticipatory. At initial contact, tibialis anterior controls foot placement, glute max and med stabilize the pelvis, and quadriceps absorb shock. This mirrors the trunk and pelvis lecture. Again, reiterating, glute med must stabilize the pelvis before loading occurs, not after. During mid-stance, quads and soleus eccentrically manage load, while glute med prevents pelvic drop. During propulsion, it is dominated by the gastroc-soleus complex and the hip extensors. During swing, hip flexors accelerate the limb and hamstrings eccentrically decelerate knee extension in preparation for contact. Recall from the hip mechanics lecture that glute max fires late swing into stance. This timing is even more critical at running speeds. clinical pearl is that many hamstring injuries occur during late swing, not stance. This table reinforces phase-specific function. Glute max fires late swing into stance to decelerate hip flexion. Hamstrings eccentrically control the tibia in late swing. Quadriceps manage early stance, shock absorption. And gastroc soleus dominate mid to late stance propulsion. This should guide both strengthening and timing-based interventions.